We finished our solid probe BodyTite coagulation, liquefaction of adipocytes, coagulation of adipose, and superficial subdermal and soft tissue matrix contraction at 40 degrees epidermal temperature. Now we're ready to aspirate, and if we can focus in here, I've got a standard vented type cannula. It's vented two ways. There's a vent on the end which allows me to decrease the aspiration pressure if I want. And then if we look at the tip, there's also venting on the tip. There's some additional holes that decrease the suction pressure at the tip. And then you can turn your aspirator, your mechanical aspirator, down to the low setting. Okay, so we're going to put this into our port. I can still feel the warmth in the tissue, and back and forth very gently, nice and gently. And if we take a look here, let's take a look at our fat, our aspirate. Let's take a look here. You can see the liquefaction. You can see the fat is not in chunks, but it's in liquid form. It's in a liquefied form. And you can see that with any energy-assisted device, but this is nice and uniform. Now, studies have shown that energy, thermal application of energy, means lower hematocrit, not zero hematocrit, but a lower hematocrit than you would normally expect. So back and forth, gently contouring, and the end point now is the aesthetic artistry of liposuction. When to stop, when you've got adequate contour. It's not the fat I'm going to remove that's important, it's the distribution and shape of the fat I leave behind. And so we've got a nice aspirate. Very little hemoglobin in this aspirate. It's clean and yellow fluid. And you can back out just a bit next so that we can also show the tubing a little bit. Show the back out so you see the suctioning and the tubing together. So that's good. Back and forth gently. So I'm fanning back and forth throughout my aspiration zones. I'm trying to stay in the areas that I already liquefied. There's no point suctioning from areas you didn't heat, or you're going to get more bleeding and more trauma. So try and stay in your deep space and then come up to your superficial space. Again, a nice yellow, non-bloody aspirate because it's been pre-coagulated. I'm using my other hand again to help me contour, to see where the tip of my aspiration cannula is. And experienced liposuction surgeons will have their own technique for gaining optimal contour. Very little resistance I'm encountering here, and this patient's had previous SAL liposuction many years ago, so this is a nice feeling when you're in there and you've pre-coagulated that very fibrous tissue. And often in young individuals like this, they're fibrous anyway. When they've had previous liposuction, it can be quite a traumatic experience, but this is very nice. The pre-coagulation of the RFAL has facilitated a nice liquefaction of this matrix that I'm removing. How you doing, Michelle?
Good.
Any pain?
No.
Excellent. I think the thermal camera will show that I'm aspirating, moving through a tissue that is warm. This tissue is still warm, it's still got its thermal effect, and this is contributing tremendously to a secondary liposuction case like this, where normally it would be quite bloody and quite fibrous. And it just shows you that the profound thermal effect of a BodyTite, an RFAL, makes this a very, very desirable, a must-have to any liposuction surgeon. Contour's looking good. We already have a couple hundred cc's off Michelle. It's looking great. Very nice. Okay, we've just about finished aspiration here, and we probably are a good 8 to 10 minutes after our thermal experience. And I bet I can still feel the warmth, the uniform warmth here in the tissue. Well, we heated to 25 millimeters at 40 degrees Celsius. I bet you that this temperature is still 37, 38, 39 degrees. So this shows you the profound and uniform and pervasive long-term temperature effect that you get from the RFAL, the BodyTite device. So this is a patient with previous liposuction. She was very fibrous. We used the RFAL to our advantage. We were able to get coagulation, liquefaction, and matrix, subdermal, and soft tissue heating. And you can see the profound thermal effect that this has had, and it certainly made our aspiration much less traumatic than standard SAL, PAL would have ever been. So let's summarize the benefits of thermal liposuction, particularly of RFAL, radiofrequency assisted liposuction. Very, very fast, effective, profound, uniform heating. What does that heating generate? Well, it produces and generates liquefaction of the adipocyte, especially in individuals that might be fibrous, like this individual had previous liposuction, very fibrous experience. So liquefaction of the adipocyte, fibrous or not. Coagulation of blood vessels, meaning if we do gentle aspiration in the same zones that we coagulated with our BodyTite applicator, we should have less ecchymosis, less bruising, and a lower hematocrit in the aspirate. And finally, a uniform thermal contraction experience. We harness all the matrix cells, the fibroblasts, myofibroblasts, subdermal, and subcutaneous fat. And it's done fast and effectively. It's got built-in safety features, online low and high impedance, cutoff temperature, cycling feedback loop, making it a very, very safe and effective tool for any liposuction surgeon. And as I mentioned, if you're going to be doing a lot of liposuction, you need to have this type of device in your practice. I thought it'd be interesting to look at the aspirate. This was a patient who was a young, athletic. It was her outer thighs. She'd had previous liposuction. It was very fibrous. And as you can see, most SAL, you would have 1/3 to 1/2 infranatant, which is your infiltration fluid, some blood, and some serum. You can see with the RFAL technique, we have about 90% liquefied adipocytes. Very low hematocrit in this aspirate. This is a patient who had previous liposuction. Very fibrous young lady, outer thighs and previous liposuction. Very clean aspirate, very little infranatant. And this will translate into what? It'll translate into less bruising, less ecchymosis, less swelling, less pain.